Hey, I'm Dr. M. It's me too. You got any questions for me today, sir? No? Wonderful. We're just going to be working on that canine. We're going to do a white feeling. I'm going to start quickly and we're going to get right on it and hopefully we'll get you out of here as fast as we can, okay? Glasses on you, and we're going to lay you down very slowly, okay? All right. Alright, so we're not going to leave him all the way back just because he does have congestive heart failure and he does have COPD, so he struggles to breathe. He also has high blood pressure as well, so we'll set him up slowly to avoid him passing out on us. Alright. So we are using 1 particle of cardigan since he has high blood pressure. Okay, we're going to be using the yellow needles and we're working on the mandible. We're going to innervate nerve AI. As the assistant said, we're going to be using 3% carbocaine due to the patient's heart issues. With a limited catheter, since his case kind of fast, it's how we're really good at it. I'm going to add the mirror, which is used for indirect vision, and the explorer, which is to check the future defects. Alright, so I'm going to be using bird 245 to cut the anatomy tooth. So I can cut the anatomy tooth and have it ready for the material. Alright, and then I'm going to place this on the face ball.
Plug it in. We are going to place a cotton roll for isolation.
Okay. Then I'm going to use a round burr to remove the decay.
Why is it doing that?
It's something. All right. Doing good, Mr. Wickenham? Yes. All right, you're doing good. That's good. All right. Again. Okay. Beautiful. And now what we're going to do is place on the mileage strip. So we can start adding in the material. We're going to be working on the medial side. Nice.
And then we are going to place some wedges to hold it in place.
Okay. All right. Next.
Normally I would pass, if there was still soft decay, I would pass the spoon excavator. Some dentists like to use the spoon excavator for manual soft decay removal.
When needed.
So next we are going to apply some limelight.
Which one? Which one? This person. Is it the wrong one?
Yep, this is the limelight.
All right. We're applying limelight because this is on the base. This helps protect the base of the tube while we start adding up all of the other material.
And then we would cure the material. For approximately 20 seconds. And then next we are going to pass etch, which helps cut the tube.
All right.
And then let it sit for about 20 to 30 seconds, or however long it says on your instructions of the etch. So first we're going to use the HDE to suction it up into an acid. And then we are going to brush it. And then dry it. And next we're going to apply desensitizer, and that helps to prevent sensitivity of the teeth. After the desensitizer, we are going to rinse and dry.
Alright. So after the desensitizer,
And then we are going to place gum and bond.
perfect.
And this helps bond the material, the composite material in the tooth.
You're doing good, Mr. Hunt. Doing good. Alright, beautiful. And my assistant had already removed the light out of the way, that way it doesn't cure while I'm applying the pollen bond. Alright. You can go ahead and cure.
And again, we cure the material for approximately 20 to 30 seconds. Now that the tooth is prepped, I'm going to pass the flowable, which builds up the tooth. And we're going to cure again for 20 to 30 seconds. And once that is complete, I'm going to pass the composite material. We're using shade B3 since these teeth are kind of yellow.
Okay.
And then I just pass the plastic instrument so the doctor can carve the anatomy into the tooth. Next, I am going to pass the H6, H7 hygiene scaler. That is for anything along the visible margin of where some of the composite material could possibly be. And then we are going to cure again for 20 to 30 seconds.
And then my assistant will remove the mileage strip and the web while I'm over here switching birds. I'm going to be using a finishing flame. to smooth out the interproximal of the canine, the medial side.
And I will be using the HDE Perfection aerosol and debris. How you doing, Mr. Wisenhunt?
So I just switch it to a finishing profile to work on the lingual side. Everything that is to touch on the finishing side, the lingual side. Then I will switch the polo. Sorry, I can't switch it because it's kind of stuck in here. But yeah, I will use the polo afterwards. Then we are going to cut the bite.
This is articulating paper, and so we're going to get him to tap, tap, tap and bite so we can see how his occlusal surface is in the bite.
Okay, bite looks good.
Alright, and then I am going to pass the cloth to check the interproximal areas of the contact.
Then afterwards, once we're done flushing, checking the bite, I will go in with the polo again and smooth out the surface, contour it.
And then now that we are all done like that, I'm going to go in with a full mouth rinse. And then I'm going to go in as well and clean off any kind of material that was left on the patient's face.
Well done, Mr. Wisenhunt. You did good. How you feeling, Mr. Wisenhunt? Good.
So we're going to I'm going to go ahead and take off these glasses and then we're going to fix it up. Stay seated for me, okay? Remember, we're setting him up slowly because he has palpable pressure. Rinse that out of the way. Alright, so your post-op instructions. I have have a hand copy, a written copy for you right here. So I want you to take it easy. You're really numb right now, so try not to chew or bite on your lips, your teeth, or your tongue. We don't want you to accidentally get hurt or have a bite mark. Be careful drinking anything too hot so you don't burn yourself. The numbing will wear off here in about 2 or 3 hours. Do you have any questions for me? No? Perfect. Alright, let me go ahead and get the sieve off of you. You can follow me. All right.